washing my hands. Hello, Harry. My name is Chriselle. I'm going to be your nurse practitioner today. How are you?
I'm doing well.
Can you verify your name and your date of birth?
Sure. Harry Kim, March 12th, 1989.
Okay, great. So right now we're just going to do a head-to-toe assessment. Is that okay?
Sure.
And before we start, I'm going to have you memorize 3 words that I want you to remember until the end of the exam.
Okay.
So just remember blue, pen, and coat.
Okay.
Got it? All right. So we're going to start. Just looking at Harry's general appearance, he looks appropriate for the weather. He's alert-oriented ×3. He's answering my questions appropriately, and he has a normal affect. He has no speech impediment, no slurring or any of that. And Harry, I'm just going to check your eyesight. Okay, so just look at this Snellen chart and cover one of your eyes and read the lowest line that you can read.
Okay. LTFPH.
Okay, and just do the same on the other.
LTFPH.
Very good. Okay, so Harry has 20/20 vision on both sides of the eyes. And Harry, just to test your memory, do you know who these last 3 presidents are?
Barack Obama, Donald Trump, Joe Biden.
Okay, great. So I'm going to check your head, okay? I'm just going to feel here. Do you have any tenderness when I touch here?
No, it's fine.
And I don't see any lesions. Harry has a normal hair distribution, no signs of balding. Also, just looking at his skin, I can see that his skin is appropriate for his ethnicity. He has no lesions, no bruising, no abnormal discoloration, no edema. He has normal skin turgor, there's no tenting, and his skin is warm and dry. And Harry, just looking at your face also, I can see that your face is symmetric. And I'm just going to check your cranial nerves, okay? So I'm just going to have you frown, smile. Okay, can you give me an angry face? And can you puff out your cheeks? Okay, so cranial nerve number 7, facial nerve is intact. Do you have any pain when I touch here?
No.
Okay, so trigeminal nerve is also intact. And I'm just going to check your temporal arteries. You don't have any tenderness when I touch here?
No.
Okay, I'm just going to have you open your jaw. Okay, close it. Open and move it side to side. Do you have any pain when I do that?
No.
Okay, so temporomandibular joint is intact, and no signs of tenderness or pain in there. And I'm also just going to be checking your eyes. So just looking at the external part of your eye, I don't see any drainage, no redness, no signs of irritation. So I'm just going to have you follow my finger just with your eyes. Okay. Alright, so patient's cranial nerves 3, 4, and 6 are also intact. And I'm just going to have you look straight. Just going to be checking your pupils. Okay, so patient's pupils are equal, round, reactive to light, and accommodation. And now we're going to be checking your ears. And just looking at, I'm just going to check your optic disc as well. So
Okay.
I'm going to be using a fundoscopy. So I'm going to be just looking straight, looking for the red reflex. Once you see the red reflex, you can get closer to your patient. You want to see the optic disc, checking for the margin, the color, and also you're looking at the vessels of the eyes. And we're also going to be checking your ears. So just looking at the outside of your ears, I can see that there are no drainage, the color matches your skin tone, and there are no lesions on the outside. So we're just going to be checking your tympanic membrane also, your eardrums. So I'm going to be holding my otoscope upside down. I'm going to pull the pinna up and back, and looking for the tympanic membrane, which should be pearly gray, which it is, and I don't see any excessive, actually there's no drainage or redness or irritation inside the ears. Alright, so now we're going to be checking your nose. Alright, so I'm going to have you close your eyes. I'm just going to have you smell this and let me know what you smell.
So like lavender?
Okay, very good. Alright, so Harry's nose is midline, it's proportionate to his face. I don't see any lesion or redness or irritation in the area. I also don't see any drainage. I'm just going to have you close one side of your nose and try to inhale. Do you have any difficulties when you do
No.
that? No, I just do the same with the other.
No, no
No difficulty?
No, I'm good.
Okay. And I'm just going to be checking also if you have any pain here on your sinuses.
Nothing.
No. Alright. So now I'm going to be checking your mouth. I'm going to put my gloves on. So just looking at the outside of the mouth, I can see that it's moist and pink. I'm going to have you open your mouth. Okay. Just checking for your tongue. And just push your tongue up. Okay, the vessels are intact. The gum is pink. Teeth are white. Okay, just push your tongue down again. Sorry. And can you say ah? Okay, so the uvula is midline. There's no redness. There's no exudates. No drainage.
Sorry, 1 second. I have to sneeze.
Sorry, that's fine. And the
No,
tonsils
fine.
are 1+
Yeah.
on both sides.
Mm-hmm.
And Harry, can you push your cheeks with your tongue?
Mm-hmm.
Okay, and the other
Okay.
side. Alright, great. And then can you stick your tongue out? Move it side to side. Okay, very good. Alright, so Harry's vagus nerve and the cranial nerves 12 are intact. So Harry, I'm also just going to be checking your neck area.
Okay.
I'm going to be assessing for the lymph nodes and trachea and arteries. So checking the preauricular, posterior auricular, your occipital lymph nodes, superficial, cervical, posterior cervical, and also your deep cervical, and supraclavicular. We also want to check for your thyroid, which should be here, and your trachea, which is midline. I don't see any deviation. And we're also going to be assessing for the carotid arteries. And when you do the carotid arteries, you want to make sure that you're only doing one side at a time so you prevent any occlusion. And you're also going to auscultate the carotid arteries, making sure that there are no bruits, which he doesn't have. Alright, so I'm going to be checking the strength of your shoulder. So if you can just push up. Okay, very good. And checking your range of motion of the neck as well. So just look side to side, up and down. Okay, and just push towards my hand. Very good. Good job. Okay, so Harry has no problems with the range of motion, even with resistance. And now we're going to be checking your extremities. Just again, we're noting for the strength and also the pulses and the reflexes. So Harry, I'm just going to check your strength. So can you push against me? Can you do this? And push against me towards you. Okay, cool. And I'm going to be checking your reflexes and your arms. I'll be checking the triceps. Okay, and just going to be doing the same on the other side. Alright, and I'm going to be checking your biceps and the brachioradialis. And basically just doing the same on the other side as well. And I'm also going to be checking for your pulses and the radial pulse. And you can also check the capillary refill and the lymph nodes also. Alright, and after the arms, you're also checking for the joints on the hands. And can you actually just do this motion and try to do it as fast as you can? Okay, good. Alright, so Harry's range of motion, upper arm strength, and pulses and movements are all normal. And now we're going to be moving on to your chest. So just assessing the outside of your chest, assuming that he has no shirt. There are no lesions, no abnormal discolorations. He's not using accessory muscles to breathe. I don't see any difficulties or with his breathing. And his breathing is symmetric. I'm just going to check your lung expansion, just breathe in and out. Alright, and I'm also going to be checking for tactile firmness. So you can just say 99
99.
over and over again.
99.
Very good.
99.
Okay, and we can also do percussion. So doing this side to side and basically from top to bottom. And you also want to check the posterior side, basically doing the same thing, doing the inspection, auscultation, percussion, and also checking for chest expansions, symmetry, and you also want to check for the AP diameter. So AP should be less than the transverse diameter, basically. And also, I'm gonna be checking for the costovertebral angle for any tenderness in the kidneys. So when I do this, do you have any tenderness?
No.
No tenderness?
Nope. It's good.
Okay, good. All right, so we're also gonna be checking for the sensations of the arm. So I'm just gonna close your eyes for me, and I'm gonna be touching you on different sides of your arms, and just tell me if it's sharp or soft.
Sharp. Sharp. Soft. Soft.
Okay, so Harry's sensations are intact. So Harry, I'm just gonna have you lay down. So we're gonna be checking your heart. While the patient is in this position, you can also check for the jugular vein pressure if you wanna assess for heart failure on patients. And we're also checking for the palpating for the apex of the heart. And also you wanna check for the left sternal border and the base of the heart. And then now we're gonna auscultate for heart sounds. I'm gonna check for the aortic, pulmonic, which are both in the second intercostal space, the Erb's point, the tricuspid, and the mitral. So Harry's heart sounds are normal. He has normal S1, S2, and no extra heart sounds or any heart murmurs noted. And we can also check for the apex of the heart. So you can auscultate this by having the patient lie on the left side. So can you just lie on your left side? Okay, so just checking for the apex of the heart. Okay, good. Very good. Okay, so just lay flat again. We're going to be checking your abdomen. So in the abdomen, again, assuming that the patient has no shirt, you're going to be inspecting the abdomen. So his abdomen is flat, no abdominal discoloration. The umbilicus is midline. I don't see any distension. And after that, you're going to be doing auscultation. So you're going to be checking for the bowel sounds. You're going to start from the right lower quadrant, working your way clockwise to the left lower quadrant. So checking if it's hypoactive, normal active, or hyperactive. You also want to check for the vessel sound. So you're going to be checking for the aorta, the renal arteries, the iliac arteries, and the femoral arteries. And then you're going to be checking for, you're going to do a light palpation, just checking for any areas of tenderness. Do you have any pain when I touch here?
No.
Okay, so you're going to do a deep palpation now. So you're going to have the patient take a deep breath. Okay, all right, check for the spleen. And you can also check for the kidneys. All right, so Harry's liver, spleen, and kidneys are non-palpable, which is the normal finding. All right, so Harry, I'm just gonna have you sit up. We're gonna be checking your legs. So just assessing the skin. There are no abnormal discolorations, no lesions, and checking the joints as well. There is no swelling or any abnormal fluid accumulation. Capillary refill is normal, less than 3 seconds. And we're also going to be I'm just going to be checking the sensations of your foot, okay?
Mm-hmm.
So close your eyes and tell me if this is sharp
It's
or
dull.
soft.
Dull.
Okay.
Dull. Sharp.
Okay, very good. So sensations on the leg is normal. We're going to be checking for reflexes. Okay, so patellar reflex. Ideally, you want the patient's legs dangling, but just for demonstration purposes, we're just going to be doing this. And Achilles reflexes. You're also checking for pulses. So you're going to be checking the popliteal pulse, dorsalis pedis, and And you also want to do this simultaneously. And dorsalis tibia. And you also want to check the strength of the legs. So I'm just going to have you push against my hands
Okay.
and push towards you. Okay. Good. And I'm also going to have you just close your eyes for a second. I'm going to write something on your palm and just let me know if you recognize what I write.
Is it like a B?
Okay, good job. And this?
It's an O.
Okay, good. And I'm gonna put an object in your hand and
Mhm.
let me know what it is.
Q-tip?
Yeah. Okay. All right. So now we're gonna be checking your gait and also your spine. So if you can get up
Okay.
and touch your toes. Okay. So Harry's back has a normal curvature. The spine is midline. I don't see any deviation. Okay. You can just stand up, and if you can put your arms across your chest.
Mhm.
And close your eyes. So you're going to be checking for the patient's gait, making sure that he's not falling to the side, which he's not. You can just open your eyes now. And if you can just walk one foot over the other.
Okay.
Okay. All right, so Harry's gait is pretty stable and steady. Can you hop on one foot? Okay, good. All right, so Harry's gait is normal. He's able to maintain his balance. And can you remember the 3 words that I asked you to remember?
Blue pen and coat.
Okay, all right, so that completes the assessment. Thank you.